It's all ours. Thank you very much for coming here on this busy day. We'd like to first acknowledge that it's World AIDS Day today, and secondary to that, my executive director is not here due to the stress of everything that's going on at this time of year in the veterans world and the losses that we've actually had of our comrades in arms. Basically, we're here today. I'm here with Chris, Shauna, who is a spouse of a veteran, Lori, who is a medical marijuana user, and she produces her own medicine. And we're here to basically talk about the recent events that has occurred within Veterans Affairs Canada. First and foremost, we have been reduced in our usage of marijuana coverage. First, we had a two-tier system within Canada. Veterans were covered, but civilians were not. This amassed what I would consider, in my own words, a usury of a market on veterans. This is not veterans' fault that we are finding a plant that is working for us, that we are replacing pharmaceuticals with. Mr. Hare has said that we can go with only covered from 3 grams. Just yesterday, I ordered my medical marijuana. It come to $2,200, taxes in. Why medical marijuana is taxed? Another question. If I had switched to what he said we're now covered with oils, and I had purchased my oils directly from these licensed producers, the cost would have been $4,900. If I had gone and reduced my script to 3 grams and purchased it under oils, it would have been $2,900 to $3,600, according to the price of oils. So if the Auditor General has been concerned with pricing, then I can assure you that what has happened really is the gaslighting of an issue, the protection of an industry. Minister Hare come out with his statement about fresh marijuana. There is nowhere in this nation that fresh marijuana is sold. Anywhere. So who is whispering in his ears? Who is doing this? Lobby? These are some very important angles to come at. First and foremost is the horrendous timing of this announcement. Veterans, I stopped counting since Veterans Week. We have lost 9 that I know of, 2 that I know personally, 1 that I have to go to a funeral, celebration of life. So you announced after Veterans Week and before Christmas that you're going to slash something that is helping our families, our quality of life, and our own health. That's horrendous in itself. That is not the propaganda that you push of care, compassion, and respect. You don't even show it in your own way in how you treat us. Mr. Hare, if I am only worth $8.50 a gram at 3 grams a day, you're telling me that my life and quality of life and that of my family is worth $25.50. When I joined the military in '94, my life was worth $42.50. Sadly, as a veteran, I'm worth less, I guess. When you look at the whole picture of this, you have directly the week after Veterans Week, the stock market and shares of these companies skyrocket to the point that they shut down the stock market. Now, with all the conversations around Veterans Week, who's getting the insider information? Because if oils are so expensive, and now we have coverage as the only group in a 2-tier system, somebody was prepped and ready. Then the announcement comes that we're cutting the gram allotment and cost and coverage, and suddenly stock markets drop 20% on that day. Smells a little fishy to this East Coaster, I'll tell you that. First and foremost, you have cash for access issues happening. Well, who's whispering into government's ears right now? We have a task force put together by Mr. Blair. To my knowledge, there's not a patient on it. You're prepping for recreational in every licensed producer. What happens to the patients? You are prepped and ready. Today, Canopy just purchased Metrum, $430 million, all under the guise of medicine. You've used us. You've used patients. You've used veterans. You've used us to select strains to work on an industry prepping for recreational marijuana, and recreational marijuana is a threat to patients because you have not put any defense to our health. They claimed for safety reasons. Right now, veterans were making their own meds. We have no problem in that. The only reason that the costs were going up is because we see there's one clear thing in the veterans community, no matter how divided anyone thinks we are tired of seeing our brothers and sisters suffer. And when you see someone getting better, and you see someone's wife talking with them and the quality of life gets better, and you realize it's a plant, of course it's going to spread. That's the awareness. And once we got aware of it, industry used us. Access points were developed around us. Business plans were developed around us. You should not punish the injured and the ill by saying you won't cover something that you just covered. You're going to cover all the pharmaceuticals that we're taking. So there's massive questions that, are going into this issue. And at the same time, it's all under the guise of medical marijuana that you're coming forward for recreational marijuana. So the usury has to stop. There needs to be a clear division between the two. If you're prepping for rec, you shouldn't be able to touch medical marijuana or vice versa. However, that is the industry that is going on in Canada right now. Major concern with these licensed producers. They say that they are the experts. They're the safest source of medicine. Their pesticides have no long-term studies for vaporization or smoking. It is pesticides for the food market. So right off the bat, hair in its reduction of coverage forces us into vaporization and smoking instead of making our own medicine and eating it, which is harm reduction. So if you are claiming that you did this for safety, I'm sorry, your actions say otherwise. The results say otherwise. Why are my brother and sisters in arms in panic? Why are they worried about having to be forced back on pharmaceutical drugs that may harm them? First and foremost, I believe the Veterans Affairs Department, if they force us back onto pharmaceuticals and that pharmaceutical is proved to injure us, you will fall under responsibility of tort liability. And we can action under the law for this damages. I'm going to hand this off. I'm a little worked up. I'm just going to hand this off to Lori so Lori can speak, and I'm going to step back.
Good morning. I'll start by thanking you all for being here. I'll explain that I'm here as managing and founding director of the Medicinal Cannabis Patients Alliance of Canada. I've been using cannabis medically in Canada for 10 years. 9 years ago, I stopped the use of all the pharmaceuticals I was using, as well as stopping drinking alcohol after 30 years of copious use. When I first started using cannabis medically, I was on 380 milligrams of 300 milligrams of OxyContin every day, as well as over 3,000 milligrams of acetaminophen, 2,700 milligrams of Neurontin, various other pharmaceuticals, and I drank. Cannabis is the reason I am here today, and I have a very close relationship with Health of Veterans. Christmas is a rough time for my family. This year, it will mark 3 years since my brother's wife took her life in Calgary. She made national news that day or the following month when my brother made it public that she took her own life because she fell through the cracks of the system. She was a veteran. She was a former military police officer and a female. I guess that's 3 strikes. I'm here to tell you that what's been happening in the market for cannabis is not medical. Clayton's already touched on the fact that fresh cannabis is not available. It's not an available option to anybody today except people like me. And I only have access 6 months of the year. Nobody's talking about gardens. Licensed producers and the media have been fear-mongering, spreading propaganda about, oh, it's so dangerous, and the hydro use. The recent article quoting the CEO of Canopy Growth, Bruce Linton, demonizes indoor grows. The global news visual that was included talks about spare rooms, hydro, smells, worry about your plants being stressed. I produce my medicine outdoors. What Clayton's Veterans Affairs account is going to be covering for medicine for him this month is about the same cost I have provided for myself for the entire last 5 years. The sun and the wind and the rain does not cost money, and it doesn't make anybody money either. The smells are the terpenes of the plant, and the right ones will reduce anxiety and stress. The value of horticultural therapy for myself, many other thousands of Canadians, and I'm sure many veterans, cannot be understated. You have less worry because you are responsible for your own health, nobody else. Recently, there's been publication of estimates of what the cannabis business in Canada is worth, massively underestimating, massively. While analysts are predicting a shortage come the recreational market. I have to say, living outside the Crystal Palace, folks have absolutely no idea how much there is, what you can buy it for, where you can buy it, or what you can get. The licensed producers who have been put in place and licensed to provide medical cannabis in Canada are clearly under a recreational model and intent. I, having used this medicine and my life depends on it, Snoop Dogg having table service parties with Tweed employees does not look good to sick people. The Trailer Park Boys doing promotions with their whiskey of the next cannabis strain that they're going to be behind. Whatever you may feel about Snoop Dogg's music or the Trailer Park Boys, what they do, it does not feel good to those of us whose life depends on the medicine. That is not medical. The refusal of doctors, our own physicians, to allow us legal access to this medicine as an alternative therapy has driven the current two-tier cash for cannabis system that we have in place now. If you can't get your doctor to agree, you can pay to get a license. Look it up. Cannabis Clinic Canada. Google it. I don't know what else I can say, except this is not medical. Thank you.
I'm just going to have a quick spiel. You have veterans that were making their own meds with 10 grams. They know exactly what strain they're putting in, and out of 10 grams, you get 1 gram of pure oil. You have industry making this oil and diluting it with no standards. They just say, okay, this one's sunflower oil, this one's with grapeseed oil, this one's whatever. It's diluted and then highly priced. We produced something pure in our homes and then moved on to use it as the medicine as we see fit. So if you're slashing the gram coverage on one and then saying, all right, we're covering oils, you're feeding the market. You're literally helping industry by taking from and forcing us to buy from. And industry won't. I put my own licensed producer to the question, and they have 4 oils. Cheapest is $150 for 50 milliliters. Most expensive is $200 for 50 milliliters. When I asked what's in your sativa oil or what's in your indica oil, they were like, oh, well, we can't give away the caramel secret. Well, I can tell you with my experience and my life experience that what they're using is what's on the chopper blades, what trimmed, the shake. They're allowed to use the excess garbage that some people would say, but it's still a medicine, to create oils and upsell again and more usury of veterans. So that is what's actually occurring. I'm going to lead off to who wants you. Chris is a preventative medic and veteran.
I'm completely unprepared today, but because Clayton is important to me, I decided to come and speak. I was a medic reservist for 6 years in the military. I was highly skeptical about marijuana as a treatment, especially for PTSD. I was brave enough to try it. And surprisingly, my anxiety scale has dropped considerably from clinical to subclinical with just occasional use, 3-4 times a week. And I don't know what to say about that. It was unexpected. I was currently taking therapy for PTSD, and we didn't know why my scores had gone subclinical until I had trouble getting some weed and they spiked again. So I don't like how veterans are treated. They should have access to a medication in the amount that their doctor deems appropriate, and it shouldn't be interfered with because of cost. If a licensed producer is charging too much for weed, that is not the veteran's fault. So I would hope that veterans could get the help they need and not be further stigmatized, because PTSD is very stigmatizing in the first place. And then to add the stigma to the medication that makes you normal again, you're not helping. And I would like veterans to get the help they need. That's all.
Go ahead. You have a little spiel if you want.
Hi, my name is Shauna Davies, and I'm a veteran myself and the spouse of an injured soldier. I had taken the time to pen a letter to Minister Hare regarding my concerns following the decision, and I just want to take a bit of time to read some of the letter today. So I urge you to please research the side effects and contraindications of diazepam, clonazepam, trazodone, zopiclone, Wellbutrin, Effexor, Celexa, Seroquel, Ambien, Remeron, Nabilone, Valium, Prazosin, Oxycodone, Demerol, Dilaudid, and fentanyl. Now imagine these medications served up in a chemical lobotomy and suicide-inducing smorgasbord. This is the treatment for our veterans suffering from PTSD and irreparable physical injuries. Please do not downplay these facts and say that this is not the reality of the situation. We've been walking this road for a long time, as have many others. I have struggled in vain to find the words to comfort a dear friend after the loss of her husband, who could no longer stand to bear the pain another day. I've helped my own husband from the brink after 4 suicide attempts, all which were proven to be caused by the medication interactions. He now has irreversible gastrointestinal damage, also directly contributed to the use of these medications. I have looked at the fear and the sadness in the eyes of our 2 little girls and felt overwhelming despair. I have cried, I have raged, and I have grieved for the man that I said goodbye to one cold February morning. Medical cannabis is not about self-harm and getting high. It is about emerging from a zombie-like state and beginning the important process of healing the body, mind, and soul. It is about learning to live and love and trust again. It is about life and finally looking forward to a future not being a prisoner of one's own body and mind. It is about relationships and families healing. It is about children getting their parents back. It is about do no harm. By not only just drastically reducing the amount of medical cannabis reimbursed, but by also placing a cap on the amount permitted per gram, you are acting very irresponsibly and causing unjust harm. Good value for money in the administration of its programs is the ultimate ultimate insult for those who have sacrificed and continue to sacrifice so much for our country. These are not faceless names on a piece of paper or disposable pawns in a political game of chess. These are husbands and wives, sons and daughters. These are friends and family, mommies and daddies. These are human beings. My husband did what was asked of him, and he did so with loyalty, pride, and courage, as did all of our veterans. And I refuse to allow him to be kicked back into that hole to wait for the demon's clutches once again. I understand, Mr. Hare, you have a difficult job to do. Our soldiers also have difficult jobs to do. Their families and loved ones have difficult jobs to do. I implore you to exhibit some of their selflessness and courage and overturn this decision to drastically reduce coverage of medical cannabis for our veterans. This is not a party. This is not a lifestyle choice. This is our medicine. This is life and death, and the consequences will be devastating. I finally have my husband back. My children finally have their daddy back, and I beg you not to take him from us again. Sorry.
One final note. Out of nowhere, you can use anecdotal evidence from outside this nation to turn around and cut our medicine. However, we cannot use data from outside this nation to ever put a claim into VAC. So you can, out of nowhere, come and change our policy for medical marijuana. But you can't come up with a policy or a study or anything to look at the mefloquine use that has been harming our soldiers. This is irony 101. What are they doing in a broken system? They're propping us up. You already have the de-recruitment of the CF. I assure you, if I'm blessed with children, none will join the CF. And I will go speak in schools, universities, and colleges to ensure that they know that they're thrown to the wolves when we're broken, that we're not taken care of, that the insurance tosses you aside, that politicians don't care. I said, we're chewed up. We're already looking at other missions in malaria-ridden areas, and you're not even studying the effect of a pharmaceutical drug, but you cannot suddenly slash marijuana. That's working. I call for every veteran on it, under no flag or banner, to arrive someday in Ottawa and show with our families just how well we're doing. In fact, I chased the last government with veterans because I'm a grassroots activist. And I assure you, 700 votes in Calgary, Mr. Hare, is not going to get you reelected next time, because we'll drive out and we'll chase you and we'll soapbox you and we'll let your constituents know exactly what you have done to our families. That's all I have to say.
Good questions.
First of all, Chris, can we get your last name? Because I don't know if you're on.
Anderson. The microphone.
Jump right up, Chris.
Okay, could I,
Sure. Yeah.
could I ask you, well, all of you, and Shauna as well, because dealing with your husband, you heard the minister. The minister says, A, he's looked at international standards. He says, B, you can talk to your doctors. He's telling us, you can go to your psychiatrist, you can go to your oncologist, you can go to your pain specialist, and you can get the dosage up.
How do we find a specialist in as little as 2 months? I mean, a pain specialist is often a 6-month wait in Canada. So you have a bunch of people who take a set amount of medication and are relatively healthy and stable, and it's going to be cut before they can see a specialist. So that doesn't really make much sense to me. I mean, that doesn't work.
He says also there's this phase-in. He says there's a phase-in until next May, so that will give you the time.
Well, my understanding is that it's immediate if your prescription renews. So, that's completely random. There's really not time. And it was already up to doctors to decide the amount you should get, right?
Do you think the decision was motivated by money?
Definitely.
And what's your reaction?
Well, we have the licensed producers on one side charging monopoly capitalist amounts for weed. And we have a government that wants to save money and not feel like they're cheated for medication. Veterans are in the middle, and we have no control over the situation. Perhaps allowing us to grow would be effective to give us an opportunity to at least have some type of competition to keep the market price for marijuana affordable.
I wonder if I can ask more broadly. I obviously covered veterans issues under the Harper government. There was a huge amount of acrimony there. And when the Liberals were elected, they had a very specific veterans platform and a number of promises they made, and a promise more generally to repair the relationship. Have they made good on that promise?
I haven't seen very much delivered. There's been a number of promises and some gestures, but no, there's really been nothing concrete yet. I mean, they've asked us to wait and see, and it's been a long time.
Anybody else able to answer that question?
One suicide is too much. 9 in the last 9 days. I'm sorry, but I mean, you just cut a medicine that was working. You are gaslighting and going out and opening up offices with minimum staff. And we have to tell our own veterans in our community, do not go to those offices yet. Give them 6 months to come up to speed. My fishing partner is the president of the VAC union. We get around, we meet, we talk. If there's one thing that is working, veterans are helping veterans. Peer-to-peer is working and propping up this broken system because we're the ones finding our friends and saving them. How can you talk to one friend on Facebook one night and find out they're gone in the morning? No, it's not working.
I mean, your husband, where is he at in terms of dosage, and how would it affect him using his rules?
Currently, he's only taking 5 grams a day, so nowhere near this 10 grams that they're assuming everyone is taking. However, just that 2 grams difference per day will be drastic.
He says, well, I've studied to other countries? You know, we've done the survey of all the other international dosages, and other vets in other countries get X, Y, and Z. They all get an average of 2 whatever.
Because of the classification of cannabis, there's never been concrete studies done. So how can you say you've gone to other countries and gotten proper dosage when there's no proof? There's no proof. And what works for a civilian who takes medical cannabis might not work for a military person who's watched their friend blow to bits. Right? We're talking two different worlds here.
Confidence that the doctor that you and your husband deal with would be able to prescribe more?
He might very well, but they say, oh, get, specialist reports there. It's not meaning that Veterans Affairs is going to approve them, right? We've been fighting for 9 years now for disability claims. They could say all they want, but, like I said, there's a lot of lip service, not a lot of action.
You talked about it in your letter, but what difference did it make to his life anyway?
It's completely night and day. Oh, sorry. He, at his worst, he was bedridden. He couldn't get out of bed. He couldn't function. I would come home from work and have to leave the kids outside to make sure that he wasn't dead in our home. I'd have to check on him to make sure he was breathing because he'd be sleeping for 24 hours a day, literally. Now he's alive. He's back. He's part of our family. He's bettering himself. He's going back to school. There's hope now. Whereas when you're literally, it's literally like a chemical lobotomy. They're just drugged out and there's no life at all. And I can't, we weren't, not that we were against cannabis, but we kind of went into it skeptical, I guess. And it was amazing, the difference.
How long is he on that drug cocktail? And then at what point, how long has it been since he's been?
He started medical cannabis July of 2015, and he was on the meds from April 2007 till that point. So we were a long time. And another point with the money is there was never any concern about the cost of the opioids that were being prescribed. And those are very expensive. If you look into the cost of pharmaceuticals, they're very expensive. So why was that not a concern? But all of a sudden, this seems to be an issue.
I could speak to the 3 gram limit.
Yep.
There's one thing I want to speak to the 3 gram limit. Here in Canada, whether or not the general public is aware, it has been possible to have legal cannabis for medical purposes for nearly 30 years. There are tens of thousands of Canadians who have anecdotal evidence, who are living the anecdote. And at one point, we have to start calling it proof in practice, because if you have tens of thousands of people who used to be on pharmaceuticals and now aren't, tens of thousands of people who used to drink alcohol and now don't, tens of thousands of people who used to be disabled and not able to function and now can, tens of thousands of people who are successful, why should we have to go to other countries to look for their standards? And cannabis is totally subjective to every person using it. I have different metabolism, physiology, conditions, symptoms as any other person. And if you pick any one of my conditions, it in combination with the others, it's, as I said, it's totally subjective. The 3 gram limit to me is arbitrary and overbroad, in the least.
What about when he says, he's quoting the 30 years of cannabis use,
Mhm.
and he's saying the average medical prescription for Canadians is 2.6 grams?
I don't know where if that was the average in the previous, I would be surprised if it was the average in the previous programs, is what I guess I want to say. Since the implementation of the MMPR and the huge balloon in the number of people using cannabis legally and the limitations put on them by the few doctors who are agreeing to do it, whether it's for cash or not, every time you have somebody put on a lower prescription, it brings the average down. When I started using cannabis, when I started talking to other people who were using it medically, legally in Canada, we were here about 6 years ago, 70 people, and our average was about 10 grams a day. I use 12 grams a day. If I can show you, this is 10. I had one of these at 6:30 this morning. I'm fine. Many of us have used a lot more. if I have one of my acquaintances actually got a letter from his doctor saying that he no longer has cancer because of cannabis oil and that he needs it till he dies. This is a doctor. And I'm not aware of anybody that I know who has had success with cannabis over the last 30 years who has had anybody ask them about that success.
Just ask a quick question.
Yep.
Are you surprised at all about the decisions of Minister Hare? Do you think it goes well with all the promises that the government did?
It came out of nowhere. I would say from industry lobby pushing for coverage with oils. Perhaps they slipped in the decrease, but it seems that it was pushed by articles from Vice, stigmatization, attacks, just the talk and the chatter about this is where it come from. You're not researching anything else. You gave no other statistics. You said safety. Well, I'm safe. I'm 5 grams a day. I've had 2 grams to get through anxiety to get here. Do you see anything wrong with my personality? Am I unsafe at this moment? Marijuana is safe. And your cannabinoid saturation rates is up to you when you're talking to your doctor. You will know when you get the right amount. So, honestly, the timing for this was horrendous. We're going into the most terrible time of the year for suicides. Why would you announce this in between Veterans Week and when a task force is coming out with lack of transparency about recreation? Why in this area? It reeks of protecting an industry versus protecting veterans. Plain and simple. If I ordered oil yesterday, which they still have to cover whatever I want to cover from now until May, it would have cost $4,900. You've solved nothing. We were making better meds. I've got a present misconceptions of the marijuana industry, 10 points over there, pick them up. I could read them. I don't know what time you got, but plain and simple, they're lying to the public, getting ready for recreational marijuana. And we are caught in between and stigmatized as patients.
A question I asked of Lori. What dosage are you at now? And you have any confidence that under the new regime you'd be able to continue on at the dosage that you need?
It's still up in the air. I've only been on for maybe 6-7 months, I think. So I'm not really sure. I'll have to discuss it with my doctor. Yeah, it has dropped. Was higher, and I think I may be able to decrease it now that my anxiety is considerably less.
You said there's been a whole debate about whether marijuana is actually good for PTSD, and you're a medic. And you think the whole bureaucracy just doesn't trust it?
Of course. There's been so much stigma on it over the years, but even since Vietnam, veterans have been taking marijuana to deal with combat stress, and it anecdotally, in my experience, it seems to be the most effective thing with the fewest side effects. So yeah, I would hope more people would try it. I would hope there would be actual studies where the scales we use to measure combat stress could be measured before and after cannabis use. Because in me, to go from clinical to subclinical is, your doctor goes, you know what I mean? They're very excited by that. And when they realize it's from marijuana, they're quite shocked.
What are you speaking of now?
Well, I was a medic, so I have to care for soldiers, and if they are not being cared for properly, I need to step up and learn new skills, if necessary.
And your thoughts on the international comparisons?
How could there be? It didn't make any sense to me. Where did they get this data? Where are veterans being treated with marijuana and the amounts and strains and the types of medicine being tested? This has never been done.
Numbers of amounts that are prescribed in different countries, they do get the overall numbers. They say, whatever it's
Sure.
Denmark or wherever it is.
Well,
as this one.
okay, but maybe a bit too much personal information. I have had pneumonia maybe 3 times. So if I smoke marijuana or vape it, because it's a mild immune depressant, I'm at much more risk to get lung infections or even progress to full blown pneumonia again. So I generally make oils in a magic butter machine. which means I have to use more weed to get the same amount of medicine, and I don't have respiratory problems. And yeah, and does it cost more? Yes, it does cost more. And that seems to be a huge factor to the government, which is troubling, because no other medication is treated, how much does it cost? That's a little unfair.
So is this going counter to the decision from the Supreme Court about other preparations of medical marijuana? Remember, you had to fight all the way to the Supreme Court to get other preparations of marijuana, and they allowed teas, infusions, cookies, brownies, whatever. But now they seem to be saying that they want you to smoke it as opposed to other uses.
Again, I would wonder about liability in the long term, and what if I get pneumonia again? Can I claim pneumonia as, so I'm taking marijuana because of an injury attributable to service. Now, because of this medication that they forced me to take in a particular way, if I get pneumonia, is that now attributable to service? Can I then? It's not wise. It's rather short-sighted.
One-on-one after.
Totally. Afterwards, we're available to everyone.
Thank you.
Thank you very much for coming on a very busy day. We have noticed. Thank you very much.
Yes, thank you all very much for coming.
Hi, nice to meet you.
This is an important subject.
I would have not left, so you live right now.